Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. I'm Brenda Himmelgarn, Vice Chair of the Alberta Health Services Board, and I'd like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. To start, we, the AHS Board, would like to recognize that our work takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. We also acknowledge the many Indigenous communities that have been forged in urban centres across Alberta. Our board members are joining us from across the province, and we acknowledge their Indigenous peoples' territories in which they live and work. Over the past 6 weeks, all of the board committees have met. We received reports and motions from the Community Engagement, Governance, Finance, and Audit and Risk Committees at our November 26th board meeting. Today, we will hear reports from the Human Resources and the Quality and Safety Committees that also met in November. We will also have several motions for consideration from the board's Finance Committee. As well, AHS President and CEO Dr. Verna Yu has some brief remarks about staying safe during the holidays. Before I turn the mic over to Verna, I'd like to let you know that the first 3,900 doses of the COVID-19 vaccine arrived in the province yesterday. Some healthcare workers in the front lines of our pandemic response were vaccinated yesterday, and many more will receive the vaccine today. This is, of course, outstanding news. It doesn't mean the pandemic is over. It just means that we might look back upon today as the beginning of the end of our current global health crisis. This is a safe and effective vaccine, and AHS will allocate, distribute, and administer it as efficiently, equitably, and effectively as possible. This won't happen overnight. The AHS COVID-19 immunization plan is scheduled to roll out in phases over the next year and possibly beyond, depending on vaccine supply. So although the vaccine is here, Albertans still need to take all appropriate steps to protect themselves and others from this highly contagious virus. And with that, Verna, would you like to talk more about the measures Albertans need to take?
Thanks very much, Brenda, and good morning to everyone. As Brenda was saying, the arrival of the COVID-19 vaccine is really good news. It provides a much-needed ray of hope at the end of a dark, difficult, and tragic year for all Albertans. But we can't afford to let our guard down. Our phased approach to vaccinating all Albertans will take time, and over the next year, we must continue to protect ourselves and others by continuing to follow public health measures. This week's arrival of the vaccine has not made the virus go away, and it doesn't bring down our current numbers of daily new COVID-19 cases or hospitalizations or ICU admissions. These numbers are already too high, and they continue to climb. Our hospital and ICU capacities are being stretched. The expanded public health measures announced this last week aim to limit the spread of the virus and ease pressures onto our hospitals. And for that to happen, we need Albertans to follow the measures. And yes, that means no indoor or outdoor social gatherings, with close contacts limited to household members only. I know it's a holiday season. It's usually a time to gather with family and friends, but we can't afford to do that this year. I'm disappointed too. I have elderly parents who would love nothing more than to spend time with us over the holidays, as we usually do. So we all need to celebrate differently this year. We need to do this responsibly and safely by spending time with family and friends through video chats, or telephone calls, or any other way that doesn't involve being together in person. Indoor and outdoor gatherings are how this virus spreads. And this is a virus that has caused more than 744 deaths in Alberta, 69 of those in the past week. That's almost 10% of all COVID-19 deaths in Alberta in just the past 7 days. Already, too many Alberta families are missing loved ones this holiday season. Too many Alberta families are grieving. Let's do our part now as we head into the final 2 weeks of 2020 to slow the spread of COVID-19 and help prevent further loss of life. That's the greatest gift we can give to each other during this holiday season. Finally, I'd like to thank our healthcare workers for their heroic efforts throughout the year, with special thanks to those working over the holidays to care for Albertans who need our help. And to all of you, I wish you all the safe, healthy, and happy holiday season. Thank you so much.
Thank you, Verna. We are participating by teleconference today. So when I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take that you are in favor of the motion. If there are none, or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
I'll move that, Madam Chair. David Carpenter.
Thank you, David. Will someone second the motion?
Stephen Mandel, I'll second that motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? Hearing none, the motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I ask Heidi Overgaard, as Chair of the Human Resources Committee, to present the meeting report for the November 25th, 2020 meeting.
Thank you, Madam Chair. The Human Resources Committee met on November 25th, 2020. The committee had a working session on its own, and then management attended to discuss our People Results Quarterly Pulse Report, Q2, 2020-2021, and updates on labor relations and on prevention of harassment and violence at AHS. The committee had no recommendations for board approval. So that's it. Thank you.
Thank you, Heidi. Thank you. I'll now ask Glenda Yates, as Chair of the Quality and Safety Committee, to present the meeting report for the November 25th, 2020 meeting.
Thank you. As you mentioned, the committee met on November 25th. We received an update on the Accreditation Canada Fall 2020 survey. We received and reviewed the Q1 Patient Safety Report, and we received an update on the status of the Alberta Surgical Initiative. The committee also received a presentation on end-to-end COVID-19 testing, an update on the Edmonton Zone COVID response to capacity planning, and an overview of the Connect Care Patient Safety Collaborative. The committee received an update on the experience of the Foothills Medical Centre in managing COVID-19 outbreaks. The committee also received an overview on home care quality and an update on the Choosing Wisely program and how it is being used to enhance clinical appropriateness at AHS. And that's my report. Thank you.
Thank you very much, Glenda. I'll now ask David Carpenter, as Chair of the Finance Committee, to present the first of 8 motions. Over to you, David.
Thanks, Madam Chair. The Finance Committee met on December the 14th, that was Monday, and I'm presenting, as you indicated, 8 motions for consideration of approval today. First, the committee considered proposed amendments to the Alberta Health Services Investment Bylaw and the Alberta Health Services Investment Policy. Management reviews the investment bylaw on an annual basis and determines if amendments are required. The committee recommended that the board approve the proposed amendments to the investment bylaw and the investment policy as reviewed by the committee. The board has considered such recommendation and the members support the approval. Accordingly, I move that the Alberta Health Services Board, A, approve the amendments to the investment bylaw and investment policy as reviewed by the Finance Committee and the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and B, direct the board chair to sign the amended investment bylaw on behalf of Alberta Health Services and management to forward the same to Minister of Health for approval. I so move.
Thank you, David. Will someone second the motion, please?
I'll second. This is Heidi Overgaard.
Thank you, Heidi. Any further discussion? Any opposed or abstentions? Hearing none, the motion is carried. Back to you, David, for the second motion.
The second item considered was the 2020-2021 budget. The committee reviewed the 2020-2021 budget and recommended board approval. The board reviewed the proposed budget and the members support the approval. Accordingly, I move that the Alberta Health Services Board, A, approve the 2020-2021 budget in the form reviewed by the committee and the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. B, approve the 2020-2021 funding amounts for the 3 wholly owned subsidiaries of AHS as provided for in the 2021 budget. Firstly, up to $146 million of funding for Capital Care Group, Inc. 2, up to $173 million of funding for Care West. And 3, up to $1.011 billion of funding for Alberta Precision Laboratories Ltd. And C, authorize and direct management of Alberta Health Services to deliver the 2020-2021 budget to the Minister of Health for approval, and after receiving such approval, make the 2020-2021 budget available to the public through the Alberta Health Services website. I so move.
Thank you, David. Will someone second the motion, please?
Hugh Somerville, I second the motion.
Thank you, Hugh. Any further discussion? Any opposed or abstentions? Hearing none, the motion's carried. Back to you, David, for the third motion.
Third, the committee was asked to consider and recommend board approval for a grant agreement between Alberta Health and Alberta Health Services relating to COVID-19 response initiatives. The committee recommended that the board approve the agreement. The board has considered such recommendation and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the COVID-19 grant agreement between Alberta Health and Alberta Health Services for a term April 1, 2020 to March 31, 2021 on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And B, delegate the authority to the Alberta Health Services President and CEO to execute such COVID-19 grant agreement on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls or commitments policy 1100. I so move.
Thank you, David. Will someone second the motion, please?
Brian Vasjo, I'll second that motion.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion's carried. David, the fourth motion?
Fourthly, the committee considered the 2020-2021 annual and COVID-19 funding to Covenant Health for recommendation of board approval. The committee made such recommendation. The board has considered such recommendation and members support the approval. Accordingly, I move that the Alberta Health Services Board A, approve the 2020-2021 acute care funding and 2020-2021 COVID-19 funding on the terms and conditions reviewed by the Finance Committee and the Board, and B, delegate the authority to the Alberta Health Services President and CEO to execute and deliver the funding letter. Covenant Health, in accordance with the delegation of authority and establishment of controls for commitments policy 1100. I so move.
Thank you, David. Will someone second the motion?
It's Glenda Yates here. I'll second that.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? The motion's carried. Back to you, David.
Fifth, the committee considered the 2020-2021 annual funding to Saskatchewan Health Authority for recommendation of board approval. The committee made such recommendation and the board has considered such recommendation and members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the 2020-2021 annual funding for acute care and clinical support to Saskatchewan Health Authority on the terms and conditions reviewed by the Finance Committee and the Board, and B, delegate the authority to Alberta Health Services President and CEO to execute and deliver the funding letter reflecting the above to Saskatchewan Health Authority in accordance with the delegation of authority and establishment of controls for commitments, policy 1100. I so move.
Thank you, David. Will someone second the motion, please?
This is Vicki Yellowwold, woman. I will second the motion.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? Motion's carried. David, the sixth motion.
I'll speak to the amendments to 4 agreements relating to the provision of home care services that were reviewed by the committee. The amendments to all 4 agreements require the board's approval and delegation of signing authority to the Alberta Health Services President and CEO in accordance with the delegation of authority and establishment of controls for commitments policy 1100. The committee recommended that the board approve the amendments, and the board has considered such recommendation, and the members support the approvals. Accordingly, I move that the Alberta Health Services Board A approve the following amendments to the agreements with the identified contracted service providers on the terms and conditions reviewed by the committee. 1. The agreement between Alberta Health Services and Bayshore Healthcare Ltd. that relates to the provision of home care services in the Edmonton and Calgary zones be extended from ending on March 31, 2021 to end on September 30th, 2022. 2. The agreement between Alberta Health Services and CBI Home Health Alberta Limited Partnership with respect to home care services in the Edmonton, Calgary, and Central zones be extended from ending on March 31, 2021 to end on September 30th, 2022. 3. The agreement between Alberta Health Services and CBI Limited with respect to home care services in the Edmonton, Calgary, and South zones be extended from ending on March 31, 2021 to end on September 30th, 2022. And 4th, the agreement between Alberta Health Services and ParaMed Inc. relating to community and congregate home care services in the Edmonton and Calgary zones be extended from ending on March 31, 2021 to end on September 31, 2022. And B, delegate the authority to the Alberta Health Services President and CEO to execute such agreement on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy 1100. I so move.
Thank you, David. Will someone second the motion, please?
Hi, Zaki. I second the motion.
Thank you, Dr. Zaki. Any further discussion? Any opposed or abstentions? The motion's carried. Back to you, David, for the seventh motion.
Next, the committee considered proposed amendments to the Master Services Agreement with Masterpiece Southland Meadows Ltd. The committee recommended that the board approve the amendments to the agreement. The board has considered such recommendation, and members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the amendments to the Continuing Care Master Services Agreement with Masterpiece Southland Meadows Ltd. to add 31 supportive living spaces and adjust the bed mix at Masterpiece Southland Meadows facility on the terms and conditions reviewed by the committee and the board. And B, delegate the authority to Alberta Health Services President and CEO to execute the amended agreement on behalf of AHS in accordance with the delegation of authority and establishment of controls for commitments policy 1100. I so move.
Thank you, David. Will someone second the motion, please?
Steve Mandel, I'll second the motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? Motion's carried. Back to you, David, for the eighth and final motion.
Lastly, Madam Chair, the committee considered proposed amendments to the Master Services Agreement with the Brenda Stafford Foundation. The committee recommended that the board approve the amendments to the agreement, and the board considered such recommendation, and members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the following amendments to the Continuing Care Master Services Agreement with the Brenda Stafford Foundation. 1. To add 83 long-term care spaces at the Cambridge Manor facility. 2. To add 2 long-term care spaces to the Beauview Manor facility. And 3. To add 37 temporary surge long-term care spaces at the Clifton Manor facility. And B, delegate the authority to the Alberta Health Services President and CEO to execute the amended agreement on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy 1100. I so move.
Thank you, David. Will someone second the motion, please?
I will, Heidi.
Thank you, Heidi. Any further discussion? Any opposed or abstentions? Hearing none, the motion is carried. We've reached the end of our agenda. I declare the business meeting adjourned. I want to thank you again for joining us, and I want to take this opportunity to wish everyone a happy, safe, and healthy holiday season. Thank you.
Together, we do amazing things every day.